Hello, everybody. We're back. Again, my name is Heather, and I'd like to thank you all for joining us today. I have with me here today two of the professors from the HIM, the Health Information Management Program. Victoria Obress, as well as Megan Bailey, are going to be doing the presentation, and we're going to walk through it. Just a quick note, a little bit of housekeeping in advance. We will be recording the session, and we're using that so that we can follow up with you later and email it out, and it'll give you a chance to wander through the information again. I want to also let you know that the presentation will be about 20 to 30 minutes, and then we will have a short Q&A session after that. Where we'll open up a Q&A box, which is on the bottom there, and the questions that you write or type in will not be visible to everybody. They will only be visible to us here. Actually, I should also mention that I have a couple of colleagues here in the room with me that are helping with the chat box and some of the other information, including links in the presentation that we'll throw up there. So we're pretty much ready to go. I think I'm going to turn it over to Victoria to get started, and here you go. Thanks, Victoria.
Thank you, Heather, and welcome everyone. So my name is Victoria Obress, and I'm the program coordinator for the Health Information Management Program. Today we're going to do just a brief overview and answer any questions that you might have as well. So what is health information management? So it's the managing of health information regardless of format. So format could be paper, electronic, or mixed media. Also creator, which is physician, nurse, physiotherapist, etc., or purpose, for care, for research, or for funding. And health information management encompasses a wide scope of practice. The key role is to maintain integrity and confidentiality of personal health information within the domains of practice. So domains of practice include data quality, privacy, EHIM, and HIM standards. So we are an accredited program here at St. Lawrence College, accredited by CHIMA, the Canadian Health Information Management Association. And there are some benefits that are associated with studying at St. Lawrence College's accredited program. And these include mandatory external placements within healthcare organizations. So you'll have a practical experience, an opportunity to work out in a community organization or other sector of healthcare. You also have the ability to challenge the National Certification Exam, the NCE, after graduating, which allows you to use the professional designation that goes along with our accreditation. And SLC practices continuous quality improvement in their educational activities, and our instructors incorporate experiential learning into their courses. So we do a lot of practical and hands-on components in our courses to get you experienced with the material and your comfort level. So what do HIM professionals do? These are sort of the four overarching areas that exist within the health information management field, and from these you can build upon and become increasing in your intricacies. And so these four fields include data quality, privacy, EHIM, and HIM standards as well. So what do HIM study? So we have health analytics courses related to biomedical sciences, coding and classifications, Canadian healthcare systems, health law, and health information technology. So currently we are waiting for approval from management before we have a finalized and specific course plan for our 2-year program. But these are the overarching topics that are covered within our program. And then continuing on, where do HIMs work? So the icons or logos depicted on this particular slide are places where our graduates have gotten jobs or areas that you could work. So including things like community care and social service, as well as eHealth Ontario, CIHI, which is the Canadian Institute for Health Information Management, and there are multiple levels of care that you can work at as well. So then what do HIM professionals, or what roles do HIM professionals have? So these are examples of specific roles. They are not the only roles that exist in the field, but these are where a lot of our graduates tend to end up. And so that includes a health records coder, which takes healthcare diagnoses and procedures and turns them into universal medical alphanumeric codes. We also have release of information specialists, which are relating to patient consent and obtaining that consent, as well as certifying medical records and deciding what information can be released to third parties. We have decision support consultants, which extract and translate, as well as relate and analyze clinical data, financial data, statistical information, and deliver it to leadership teams and stakeholders to support their decision-making and evidence-based practices. And then we also have privacy analysts, which conduct privacy impact assessments, so PIAs, and they provide subject matter expertise on policies and processes, privacy requirements, and legal agreements and information governance. So how much money will you make as an HIM? So these are minimum wages according to particular job postings in the areas that are listed below. This was pay rates at this time per hour for January of 2018, so this time last year. So in the Kingston area is $27 an hour. In the Napanee area, we found about $24 an hour. In Ottawa or Toronto, $30 an hour, and then Alberta and British Columbia is upwards of $36 an hour. And these also include wages for certified health information management professionals, so people that successfully sit for their NCE exam. After that, our graduate employment rates. So this was collected from 2013 onwards to 2018. And so HIM is a broad discipline, but generally our students transition into 5 areas after graduation. And this includes records management, coding, release of information, decision support, and EMR adoption. Time has also been spent developing relationships with instructors and students to understand their aspirations for a career in HIM. So we will provide guidance and assistance in figuring out what your aspirations are and where you'd like to go, as well as how we can get you there. So our admission requirements for our program include grade 11 math, grade 11 biology, and a grade 12 English course. So those would be direct admission requirements for students straight out of high school. And international students will need to have their credentials reviewed by our International Studies Department, which will identify equivalencies. And their email is present in our slide presentation, and they also have a page on the St. Lawrence College website that you can visit for more information. So from here, we also accept credit transfers and exemptions. So typical classes that receive transfer credits or exemptions include anatomy and physiology courses, statistics courses, as well as our general education courses. And after accepting your offer to the program, you can apply for previous credentials to be evaluated by our transfer credit advisors. And they also have a page on our site, which is linked in this section as well. So from here, these are articulation and postgraduate pathways. These are pathways that are working with the HIM program so that you can further your current education. So after you take our program, there are pathways that you can take advantage of to further your education. So financial aid, scholarships, and bursaries. There are alumni of St. Lawrence College, and they have provided extensive scholarships and bursaries as part of a bursary program to help you pay for college. And so there's a link to that section as well. The Ontario Student Assistance Program, so OSAP, is a form of financial aid that contributes combined grants and loans for students. They have their own website, which we've linked here as well. And then we also offer a tuition payment plan to assist students who are having difficulties paying their deposit and their tuition by the scheduled dates. And the scheduled dates are found upon our website as well. And you can visit the direct link for student tuition payment plans. So this is my contact information. It's vobress@sl.on.ca. And we also have a generalized HIM email as well. You can email either one of those, and Meg also has access to the HIM email. So if it's a general question and you'd just like to shoot off an email to either one of us, you can use that HIM email and someone will get back to you. Meg, do you have anything you want to add at this point?
No, I think you pretty much covered it, Victoria. So I think maybe we should move on to the questions.
All right. Well, thank you both for that great presentation. It's Heather again, and I think what we're going to do is we're going to switch over to a Q&A session. So I hope that Victoria has certainly answered most of your questions, but if you will just click over to the Q&A tab now. Oops, sorry, there we go. I wanted to let you know that all of the questions that you ask will be confidential and will not be seen. We will be responding to the questions audibly so that everybody can hear them and they will become part of the recording. So again, if you have some questions now, please go ahead and pop them in. And we'll just take a minute. We'll go on mute for a minute, and we will go ahead and start answering some questions. Okay? Okay, it looks like we have a couple of questions. Victoria, can you help?
Sure. So the first question we have is about admissions and meeting the requirements. So if you don't have your grade 11 bio, the question is, what can you do about that? So if you are missing one of the key courses, what you can do about that is there are programs here at SLC that allow for mature students and adult learners to meet those high school requirements to get admission into a particular program. So it's called the ACE program, and there's more information about that on the SLC website, and you can go search that up and demonstrate your pathways from there. So the next question that we have is, do you know the success rate of SLC grads who write the certification exam? So perhaps Meg could speak to that question.
So approximately 1 or 2 students every year will fail the national certification exam, or they will choose not to take the national certification exam. So we don't necessarily have the best information to provide concrete examples or concrete numbers, because we're not really given a report by CHIMA due to confidentiality rules about who failed. We just have an overwhelming number of these are the number of students who passed from your program. So we can't actually tease out the information to provide a direct answer, other than to say 1 to 2 students every year tend to not take the exam or fail the exam.
Okay, do we have any other questions out there? Maybe we'll just go on mute again just for another minute and see if there's any other questions that come up. Okay, thank you. Here we go, a few more questions.
So what is the job prospect and how fast can we land jobs after graduation? Maybe I'll pass that one to Meg as well.
So it depends year to year. Again, so the students who just graduated at the end of August, as the previous one of our slides depicted, we had 16 people graduate. 13 of those 16 graduates have jobs. So within 4 months of graduating, 13 out of the 16%, 13 out of the 16 students, have a job. The year before that, it was 22 out of 24 had a job within 8 months, I believe was the timeline there. So you have a pretty good perspective. And I think we also need to qualify how and when those students are getting jobs. So if you are willing to relocate anywhere in Canada, if you are willing to leave the Kingston area to get a job, you will definitely get a job if you're willing to keep your options open. There are some students every year that for various reasons, they are not willing to relocate, they're not willing to commute, they have chosen to go in a different direction and maybe are now looking into nursing or potentially a non-health information management pathway for their career. They choose not to. So I think we have some very strong numbers there to support the good graduate employment rate.
So that one was answered. Maybe we can go to that question.
So you have a Bachelor of Medicine and or a Bachelor of Surgery, and have we previously had any candidates who apply with this type of credential?
So we actually just graduated a student out of last year's class. He was an anesthetist from Egypt, and he actually is working at a community health center as a data management coordinator. And he was one of the students who actually got a job within a month of graduating. So yes, we have had students, internationally credentialed medical professionals, that have gone on to be very successful in their careers, especially coming out of HIM program. And I believe that is due to the dedication of faculty and the community members of having good relationships with one another, so that when jobs appear, they can call up St. Lawrence College and call up faculty members and say, we have this job available for us. Do you have anybody who would be good in this position?
All right, and it looks like there's one last question there. So could you define the program duration? Is it 2 academic years, as last year it was 1 academic year only?
So last year it was 3 academic terms, which was 12 months. The new program of study is anticipated to be 16 months in length, so 2 academic years, so 2 or 4 4-month semesters is the other way of looking at it. We still do not have approval from management as to what exactly the timeline would be. However, please keep on checking our HIM program website on the St. Lawrence College website to get the most up-to-date information, and it'll be posted there as soon as we have our approvals.
So interest in clinical research associate programs, is the HIM program similar, Meg?
So you can do clinical research with an HIM diploma. It really depends on what the job employer is looking for. So clinical research, we've seen a lot of students actually go into working with the Institute for Clinical and Evaluative Sciences in the past, and working with Cancer Care Ontario and also the academic researchers as well. It really depends on the skill set that the clinical researchers are looking for, or the clinical that the job employers are looking for. So if they're looking for somebody who can do some analytics or do some statistical reporting and support them there, an HIM can do that. If they're looking for somebody to maintain the research data set for privacy and confidentiality, an HIM can do that. If they're looking at how they will collect, use, and disclose all the information from the study, that's something that an HIM can do. So we've had students go into clinical research in the past, most recently with Queen's, with the Institute of Clinical and Evaluative Sciences at Queen's, and also just being a research associate with with Queens as well, but we don't. It really depends on that job.
So, multiple questions for admissions requirements for international students. So we have linked the international email, which is international@sl.on.ca, where you can direct your questions specific to international admission requirements.
And just so that you know as well, we are going to be posting that on in the chat box. It'll be up there shortly, and you should be able to go through from there.
So a couple more questions here. The English requirements is IELTS academic with an overall score of 7. Is that enough?
IELTS.
Definitely.
Okay.
Our actual requirements are less than that. To get the exact requirements, you can look at the program webpage, and you can also look at the St. Lawrence College website as well. So if you have a 7, it's definitely above what our exact measures are, but I don't know the exact measures. I believe it is a 6.0 overall.
So with regard to exemptions, does it mean that students will pay less tuition fees?
So that is a question for our finance team. However, it really depends on a case-by-case basis as to how much you are willing to transfer over and whether or not you need to maintain full-time status. If you maintain full-time status as a student, you will not get a reduction in tuition costs.
Okay, I think we're putting up a little bit more information and links as well into the chat box, but it doesn't look like we have any other questions right now. So perhaps we'll just go on mute for one more minute and see if there's any other questions that pop up. And if not, then we will just close the session out. So please pop up any other questions that you have. Thanks.
Hi there. So just one more question came in about having other degrees and previous education as an international student, and whether or not you need your high school degree. So that would be a question to forward on to international, and I believe that it's gotten put into our chat box, the direct email for international as well.
Yes, it's there to connect. So Victoria, you're right on that. So it's been a lot of really great questions. Do you have anything else to add, or is there any other information that you want to throw out there to our prospective students?
So we've actually gotten some information from our marketing and our recruitment team that we actually have double the number of applications over last year. So if you are seriously considering joining the HIM program, I would encourage you to apply as soon as possible, and definitely by the February 1st deadline.
Equal consideration date, that's great. All right, and something else for you to think about, it's Heather again, and I wanted to let you know that if you are in the area and you wanted to come in and book a tour, we are more than happy to take you on a tour of the school and to meet some of the faculty and the students even, so that you can chat with them. And we also are we're hosting an open house in April, on the 6th of April, it's Saturday, and we'd be really happy for you to join us for that as well. It's a really great opportunity, again, for you just to see the school and to meet some people and to get all your questions answered. So it doesn't look like we have any other questions. So, and you feel like you've covered everything?
I do. Thanks very much for hosting this, Heather, and thank you very much to everyone for participating, and we look forward to receiving applications.
Wonderful. All right. Well, just so that you know, we will be following up with an email shortly, probably by the end of the week, and we'll include in it this recording as well as all of the links that we've talked about. And hopefully if you have any other questions, as well as contact information for both Meg and Victoria, so that if you have any other questions, we would be happy to help. So thanks again for spending your time with us. We look forward to seeing you here at St. Lawrence College. Thanks all.